Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about CMS Final Rule for calendar year 2024 Hospital Outpatient Prospective Payment System and Ambulatory Surgical Center Payment System. Let's get started. Some of the takeaways from this final rule are as follows. Updates to Outpatient Prospective Payment System and Ambulatory Surgical Center payment rates. In accordance with Medicare law, CMS is finalizing outpatient prospective payment system payment rates for hospitals and ambulatory surgical centers that meet applicable quality reporting requirements by 3.1%. This update is based on the projected hospital market basket percentage increase of 3.3%, reduced by a 0.2 percentage point for the productivity adjustment. Ambulatory surgical center rate update based on the hospital market basket. In the calendar year 2019 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule with comment period, CMS finalized a policy to apply the productivity adjusted hospital market basket update to ambulatory surgical center payment system rates for an interim period of 5 years, calendar year 2019 through calendar year 2023, during which time CMS would assess whether there is a migration of the performance of procedures from the hospital setting to the ambulatory surgical center setting as a result of the use of a productivity adjusted hospital market basket update. However, the impact of the COVID-19 public health emergency on healthcare utilization, particularly in calendar year 2020, was tremendously profound, particularly for elective surgeries, because many beneficiaries avoided healthcare settings when possible to avoid possible infection from the SARS-CoV-2 virus. Therefore, for this calendar year 2024 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule with comment period, CMS is finalizing extending the 5-year interim period and additional 2 years through calendar year 2024 and calendar year 2025. This will enable CMS to gather additional claims data further removed from the COVID-19 public health emergency to more accurately analyze whether the application of the hospital market basket update to the ambulatory surgical center payment system affects the migration of services from the hospital setting to the ambulatory surgical center setting. Intensive outpatient program. Medicare continues to cover inpatient psychiatric admissions, partial hospitalization programs or PHP, and outpatient therapy for behavioral health conditions. However, there has been a coverage gap when patients require more intense services than traditional outpatient therapy but less than inpatient level care that a partial hospitalization or hospitalization would provide. In the calendar year 2024 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule with comment period, CMS closes this coverage gap for behavioral health by establishing payment for intensive outpatient program or IOP services under Medicare. The final rule includes the scope of benefits, physician certification requirements, coding and billing, and payment rates under the Intensive Outpatient Program benefit. Intensive outpatient program services may be furnished in hospital outpatient departments, community mental health centers, federally qualified health centers, and rural health clinics. Intensive outpatient program services may also be furnished in opioid treatment programs for the treatment of opioid use disorder. These policies are expected to promote access to needed behavioral health care significantly. Scope of benefits for intensive outpatient program. CMS is setting forth the scope of benefits for intensive outpatient program services as mandated by Section 4124 of the Consolidated Appropriations Act of 2023. An intensive outpatient program is a distinct and organized outpatient program of psychiatric services provided for individuals who have an acute mental illness or substance use disorder consisting of a specified group of behavioral health services paid on a per diem basis under the outpatient prospective payment system or other applicable payment system when furnished in hospital outpatient departments, community mental health centers, federally qualified health centers, and rural health clinics. CMS is finalizing a consolidated list of service codes to be included in intensive outpatient programs that have been and are paid for by Medicare either as part of the partial hospitalization program benefit or under the outpatient prospective payment system more generally. In addition, CMS is adding service codes to recognize activities related to care coordination and discharge planning, as well as to recognize the role of caregivers and peer support specialists in partial hospitalization programs and intensive outpatient programs. Physician certification and plan of treatment requirements for intensive outpatient program, as amended by Section 4124A of the Consolidated Appropriations Act of 2023, Section 1861 FF1 of the Social Security Act, requires that a physician determine that each patient needs a minimum of 9 hours of intensive outpatient program services per week. This determination must occur no less frequently than every other month. CMS is codifying this requirement in regulation for intensive outpatient program provided in all settings. Intensive outpatient program payment rates and policy in hospital outpatient departments and community mental health centers. CMS is establishing two intensive outpatient program ambulatory payment classifications or APCs for each provider type, one for days with 3 services per day and one for days with 4 or more services per day. For calendar year 2024, CMS is finalizing hospital-based and community mental health center intensive outpatient program payment rates for 3 services per day and 4 or more services per day based on cost per day using a broad set of outpatient prospective payment system data that includes partial hospitalization program days and non-partial hospitalization program days for the same services CMS is recognizing for PHP and intensive outpatient program. While no Medicare intensive outpatient program benefit currently exists, CMS believes using the outpatient prospective payment system data set will allow them to capture data from hospital claims that are not identified as intensive outpatient program but that include the service codes and intensity required for an intensive outpatient program day. Rural health clinics and federally qualified health centers. For calendar year 2024, CMS is finalizing conforming regulatory text changes to applicable rural health clinic and federally qualified health center regulations related to the scope of intensive outpatient program benefits and services, certification and plan of care requirements, and special payment rules for intensive outpatient program services as mandated by Section 4124 of the Consolidated Appropriations Act of 2023. The scope of intensive outpatient program benefits and certification and plan of care requirements will be the same for rural health clinics and federally qualified health centers as described before for hospitals. CMS is finalizing payment for 3 intensive outpatient program services/day, and according to the statute, payment is based on the hospital rate. That is, rural health clinics will be paid the 3 services per day payment amount for hospital outpatient departments. For federally qualified health centers, payment will be the lesser of a federally qualified health center's actual charges or the 3 services per day payment amount for hospital outpatient departments. For grandfathered tribal federally qualified health centers, payment will be the Medicare outpatient per visit rate as established by the Indian Health Service or IHS when furnishing intensive outpatient program services and payment is based on the lesser of a grandfathered tribal federally qualified health center's actual charges or the Medicare outpatient per visit rate. Partial hospitalization program Partial Hospitalization Program or PHP rate setting. The calendar year 2024 Outpatient Prospective Payment System / Ambulatory Surgical Center Final Rule with comment period includes updates to Medicare payment rates for partial hospitalization program services furnished in hospital outpatient departments and community mental health centers. The partial hospitalization program is an intensive, structured outpatient program provided as an alternative to psychiatric hospitalization, consisting of a specified group of mental health services paid on a per diem basis for a minimum of 20 hours of partial hospitalization program services per week under the outpatient prospective payment system based on partial hospitalization program per diem costs. Update to partial hospitalization program per diem rates. CMS is expanding the existing rate structure to include two partial hospitalization program ambulatory payment classifications for each provider type, one for days with 3 services per day and one for days with 4 or more services per day. As a result, CMS is appropriately increasing payment rates for higher intensity days in all settings. For calendar year 2024, CMS is calculating hospital-based and community mental health center partial hospitalization program payment rates for 3 services per day and 4 or more services per day based on cost per day using outpatient prospective payment system data that includes partial hospitalization program and non PHP days, which is a change from the current methodology of using only PHP or partial hospitalization program data. CMS believes using the outpatient prospective payment system data set will allow CMS to capture data from hospital claims that are not identified as PHP but that include the service codes and intensity required for a PHP day. Clarification about substance use disorder or SUD treatment under partial hospitalization program or PHP. CMS is clarifying in the calendar year 2024 final rule that Medicare covers PHP for the treatment of substance use disorders or SUD. Specifically, CMS is clarifying that in general, notwithstanding the requirement that PHP services are provided in lieu of inpatient hospitalization, Medicare covers PHP for the treatment of substance use disorders, and CMS considers services that are for the treatment of substance use disorders and behavioral health generally to be consistent with the statutory and regulatory definitions of PHP or partial hospitalization program services. Changes to community mental health centers conditions of participation. The Consolidated Appropriations Act of 2023 established coverage of intensive outpatient program in community mental health centers. The legislation extended Medicare coverage and payment of intensive outpatient program services furnished by a community mental health center beginning January 1, 2024, allowing coverage of both partial hospitalization program and intensive outpatient program services. Additionally, the Consolidated Appropriations Act of 2023 established a new Medicare benefit category for marriage and family therapist services and mental health counselor services. To implement these provisions of the Consolidated Appropriations Act of 2023, CMS is finalizing as proposed to modify the requirements for the community mental health centers to include intensive outpatient program services throughout the condition of participations. CMS is also finalizing their proposal to modify the community mental health center conditions of participations for personnel qualifications to add a definition of marriage and family therapists and revise the current definition of mental health counselors. CMS is also finalizing the addition of marriage and family therapists and mental health counselors to the list of practitioners who can lead interdisciplinary team meetings when deemed necessary. Lastly, CMS solicited comments on how the provision of the intensive outpatient program services may impact the populations community mental health centers serve, as well as the potential impact on meeting the 40% requirement. CMS appreciates the commenters' feedback and will consider responses for future rulemaking. Hospital outpatient slash ambulatory surgical center slash rural emergency hospitals quality reporting programs. Let's talk about hospital outpatient quality reporting and ambulatory surgical center quality reporting programs. The hospital outpatient quality reporting and ambulatory surgical center quality reporting programs are pay for reporting quality programs for the hospital outpatient department and ambulatory surgical center settings, respectively, that require hospitals and ambulatory surgical centers to meet quality reporting requirements or receive a reduction of 2 percentage points in their annual payment or fee schedule update if these requirements are not met. In the calendar year 2024 Outpatient Prospective Payment System slash Ambulatory Surgical Center Final Rule with comment period, CMS is finalizing modifications of three measures in both of these programs. First, the COVID-19 vaccination coverage among healthcare personnel measure to align with the updated Centers for Disease Control and Prevention or CDC National Healthcare Safety Network measure specifications. 2. The cataracts improvement in patient's visual function within 90 days following cataract surgery measure to require use of one of three specific survey instruments to measure change in visual function pre and post operatively to further standardize data collection and reduce facility burden. And number 3, the appropriate follow up interval for normal colonoscopy in average risk patients measure to align with updated clinical guidelines. In addition, CMS is finalizing with modification the adoption of a new measure in these programs, the risk standardized patient reported outcomes following elective primary total hip and or total knee arthroplasty measure. CMS is finalizing this measure with modification to extend the voluntary reporting period to a total of 3 years prior to requiring mandatory reporting beginning with the calendar year 2028 reporting period for the calendar year 2031 payment determination. CMS is not finalizing its proposal to readopt the hospital outpatient slash ambulatory surgical center facility volume data on selected outpatient surgical procedures measure after consideration of commenters' feedback. Further, CMS is finalizing with modification the adoption of an additional measure in the hospital outpatient quality reporting program, the adoption of the excessive radiation dose or inadequate image quality for diagnostic computed tomography or CT in adults, electronic clinical quality measure or ECQM to promote patient safety. CMS is not finalizing its proposal to remove the left without being seen measure due to a recent increase or worsening of left without being seen rates in their routine monitoring and evaluation that warrants further investigation. Rural Emergency Hospital Quality Reporting or REHQR program. The REHQR program is a new quality reporting program for specially designated rural emergency hospitals or REHS that must provide emergency department services and observation care and may also opt to provide additional outpatient services. Rural emergency hospitals are required by statute to submit quality measure data. In the calendar year 2024 Outpatient Prospective Payment System slash Ambulatory Surgical Center Final Rule with comment period, CMS is finalizing the adoption and codification of several standard quality program reporting policies as well as the adoption of 4 initial measures for the Rural Emergency Hospital Quality Reporting Program. The 4 initial measures, consisting of 3 claims-based measures and 1 chart abstracted measure, are: first, abdomen computed tomography, use of contrast material; 2. Median time from emergency department arrival to ED departure for discharged ED patients; 3. Facility 7-day risk standardized hospital visit rate after outpatient colonoscopy; and number 4, risk standardized hospital visits within 7 days after hospital outpatient surgery. In addition, CMS summarized comments received on the use of electronic clinical quality measures, care coordination measures, and a tiered approach for quality measures and reporting requirements to incentivize rural emergency hospital reporting. This is it for today. Hope you found this information useful. If you enjoyed this video, please consider subscribing to my channel. Thank you for joining me. Bye now.